So, hello all. My name is Dr. Haresh Gupta, and I am working in the capacity of Head of Medical Program Can Kids Kids Can. So, today the topic of my presentation is shared care for children with cancer during the COVID pandemic. Can Kids is the National Society for Change for Childhood Cancer in India. We people are currently working in 116 centers pan India, and there are 57 cities and 28 states where we people are currently functioning. We people are also having our 15 access to care state projects that is covering 94% of the total incident of childhood cancer in India. And currently we people are having 3 memorandum of understanding as a technical partner with government of Maharashtra, with government of Punjab, and with the government of West Bengal. One of our program is called You Are Not Alone. It is an umbrella program that ensures the best treatment, care, and support for the children with cancer and their families in India. The vision of Can Kids is to enable global standard of survival from 70 to 95% for childhood cancer in India. And we people are fighting for the right to health, quality of life, and the care for children with cancer and their families throughout their cancer journey. Two of our models are Can Kids Hospital Support Unit and Change for Childhood Cancer State Projects. In Can Kids Hospital Support Unit projects, we people are enabling the best treatment, care, and support to children who have already reached a treating center. In Change for Childhood Cancer State Project, we people are ensuring that the child should be detected on time, they should be diagnosed properly, and they should refer to a proper treating center. And they received the treatment under the shared care model or at the center where they are being referred for. So there are 10 program areas and there are 25 core services in partnership with the cancer hospital where we people are working at right now. Under the Change for Childhood Cancer State Project, there are 15 state projects we people are working for, and we people have to ensure that children are again detected, they are diagnosed properly at an earliest point, and they are referred to the right cancer treating center. So from the inception of Can Kids Kids Can in 2004 till this date, we people have reached 53,000 families. And we people are working in 116 centers, and there are 15 dedicated state projects. There are 28 states where we people are working, and there are 57 cities where we people are. Now, during the COVID pandemic is the pandemic where the various governments and where the WHO has declared as a pandemic, and where the people has to take care of the health emergencies. WHO has declared COVID as a pandemic on 11th of March 2020, and Government of India has declared it as a disaster on 15th of March 2020. As a federal structure and as per the Constitution of Government of India, health is a state subject. So in India, we people have got hospitals, those who are governed by the state government. There are hospitals, those who are governed by the central government, and there are hospitals, those who are governed by the trust hospital, those who are called trust hospitals. One of the hospitals is called Loknayak Jayaprakash Hospital. It is governed by the government of Delhi, and it is one of the biggest hospital of government of Delhi. It is in Delhi, right? It was declared as a COVID designated hospital on April 6, 2020. And at that time, there are 5 patients, those who are admitted in the hemato-onco ward, those who need immediate attention and care. The treating doctor has contacted Can Kids immediately how we people can help these patients to be referred to a higher center so that the treatment of these children can be taken care of. Can Kids has got a network of around 116 centers that I have already mentioned, and we people have contacted our whole network in the Delhi NCR region, and we people are able to make a contact with few government hospital and the private hospitals, though they were assigned some beds for the COVID patient, but they are giving treatment to the children, those who are suffering from cancer. The doctor is contacted Can Kids. Can Kids has got a tie-up with the, Conkids has developed a standard operating procedure for the shared care model. We people have contacted the secondary centers, and in the government hospital where we people are working, we people have tried to, supplement with them with drugs, with diagnostics. At the private hospitals, we people have negotiated the best possible rates for the children, those who are suffering from cancer. CanKids has developed a standard operating procedure for the shared care model that we people have developed during the COVID crisis. Before that, though we have a shared care model, but that was not as powerful as that we people have developed this time. The enabling factors for the shared care model this time is our network of the various hospitals and the doctors that we people are working for in Delhi NCR region, our support, our dedicated social support team, those who are working in most of the hospitals, our network of pharmacy and the diagnostic centers, Pandaria and Delhi NCR region, and we people have constituted an emergency response committee, and the role of emergency response committee is to ensure the guidelines by the state government, central government, and WHO has to be followed by all our social support team members in the field. We people have started a patient transport services to ease the transportation between various hospitals, because in the lockdown situation there was no transport that is available for the patient to from one area to the other places, and we people are able to arrange the COVID medical essential kits for the all the staff and for the families those who are coming to us, and we people are able to raise funds for Change for Childhood Cancer under COVID initiative. Now, this is the process we people have taken care of. The doctor at the principal treating center have contacted our chairperson. Then we people have ensured how many patients are there. We people have taken the summary from that doctor. Then we people have established a contact with the secondary treating center. Then we people have got our regional coordination centers. Now, the doctor, after having a virtual meeting with the doctors, we people are able to formulate a care plan for the children, those who need to be shifted from primary treating center to the secondary treating center. And our regional care coordination center has played an important role by transferring the patient from principal treating center and the secondary treating center. And we people have our social support team that was there at both places to hold the hand of the family. We people have identified the hospital, those who are able to provide us the services during the COVID time. At the government hospitals, though the most of the charges, the bed charges are free, the doctor's fee are free, but sometimes they do need drugs and the diagnostic for the treatment of the child and for to make the further diagnosis and to make the further adjustment in the treatment of that child. At the private hospital, we are able to negotiate the best packages for the children. All the cost has been borne by the candidates, and there is not a single penny is being spent by the family and the child during this journey. Now, this is the slide of the hospital that we people have taken care of during the COVID time. There are 58 children. Those have been assessed during the period from April to November 2020. There are various hospitals, those who has been designated as an COVID hospitals by state government and by government of India. And you can see the patient has been shifted from one hospital to the other hospital. And the hospital where they have been shifted, these are the private hospital and public trust hospital and the public hospital. Total, we people are able to support 58 patients during this journey. Now, there is a special case that I would like to highlight. When the AIIMS Patna is designated as a COVID hospital, Patna is a city in the state of Bihar, which is around 1,000 kilometers away from Delhi NCR region. And when Bihar is being declared as a COVID state and the hospitals are designated at the COVID hospital, then we are unable to adjust those children in the Patna city. There were 10 patients, those who need urgent medical attention when the AIIMS is being declared as a COVID designated hospital. We are able to adjust only 4 patients in the city of Patna, and rest 6 patients we thought of shifting them from Patna to Delhi. 6 patients and their 11 caregivers boarded special trains that has been arranged by the Indian Railways, and everything has been arranged by Cankids. 23rd of July at the night 7 p.m. They boarded a train from Rajendra Nagar terminal, and they have reached on 24th of morning in Delhi. Our care coordinator was there at the railway station to hold the hand of the families, and they have been taken to our care centers in Delhi. And very next day, we are able to take them to Indraprasth Apollo Hospital, Delhi, for the treatment purpose. 58 patient has been supported during this shared care model from 6 hospitals from April to November 2020. Only one patient had abandoned treatment. There is only one casualty. 291 trips has been arranged by the patient transport services for a cumulative stay of 174 days at our home away home in Delhi region. There is a median age of 80 years, and the hospitals of origin are from Bihar, Uttar Pradesh, West Bengal, and Delhi. Total expenditure we people have incurred is 61 lakh. It is US dollar. It is around 84,000 US dollar, and the median expenditure is around Indian rupees 41,000. Indian US dollar, it is 564. The conclusion that we people have drawn is that the role of care coordination is vital in the whole journey from primary treating center to the secondary treating center. Care coordination is not a single person activity, and the management of a child who is being transferred from one hospital to the other hospital. We need the support from primary treating center and the doctor who is at the secondary treating center. That is why the virtual meeting is being arranged before the patient is being transferred from one center to other center, and the regular follow-up is being given. Weekly follow-up is being provided from our secondary treating physician to the doctor at the primary treating center, so that the children after completion of the induction phase can be transferred back to the primary treating center. What we have done is that this is the best model that can be implemented later on in the LMIC countries like India, where we people have integrated healthcare at all levels, from tertiary, from secondary, and the primary, from the moment of diagnosis and from the the maintenance and the continuity of care. Thank you very much.